Welcome back, everybody, to the OPT Network. This morning, we're talking about plastic surgery. So if you have been considering whether or not you should get plastic surgery, this is a conversation that you absolutely want to stay on point for. Our guest this morning is Dr. Stephen Maguire. He has been helping people with their imperfections for nearly 2 decades. He's at MidState Orthopaedic, and he joins us this morning to talk about mommy makeovers, breast reductions, and a lot more. Dr. Maguire, good morning. Welcome.
Well, thank you very much. I appreciate you having me this morning.
Absolutely. So everybody really is talking about mommy makeovers, a lot of women, that is, and now plastic surgery has become more accessible.
Correct.
And affordable to just everyday people. So let's start by talking about what mommy makeovers are.
So a mommy makeover isn't a specific thing.
Okay.
It's a kind of a catchphrase. It's thrown around kind of lightly, and it means any surgery that involves the breast and the belly.
Okay.
So those are the two areas most affected by a pregnancy, the making of the mother, and usually there's a man involved somewhere there.
But he doesn't have the outcomes.
No, he doesn't need surgery afterwards.
After the baby.
And so for the breast, it's either going to be a reduction, an augmentation, or a lift, depending on the changes that occurred as a consequence of the pregnancy. The breastfeeding, of course, and then afterwards there's some deflation. There's a lot of changes that can occur. And even if a woman doesn't breastfeed, there's often changes associated with the pregnancy to the breast. And then, of course, on the abdomen, especially the lower abdomen with the enlarging uterus and the baby, and that skin never quite snaps back in quite the same way.
Why? Why? Do we know why? It's just the elasticity in the skin. It just generally doesn't
we
bounce
exceed
back.
the skin's capacity for elasticity. So the skin is elastic, and some people, and you see it with the stretch marks. So some women have a pregnancy, not a single stretch mark. Other women, lots of stretch marks. And the stretch marks are where the dermis tears, but the epithelium on top stays intact.
And what does that mean exactly?
Well, it means it's not coming back. That's the short answer, is that it's not going to snap back magically. And I think it's important for people to realize that things like liposuction, which work great for love handles and other areas, don't cause any significant skin retraction. A little, but not a lot. And so it's important to make sure that a woman gets the right surgery for the right problem.
So for skin elasticity where it's stretched or you have that extra skin on your belly, liposuction is not going to help that.
It will not. It'll help the contour so that in Spanx
so what does that
or in a
mean,
compression
the contour?
garment, in clothing, she would look like she's lost weight, but then she's going to have a lot of loose skin. And that's going to leave a little bit of a roll over the belt line. It's not, it's less than ideal. And so if she needs that, then that'd be a tummy tuck. So that's a skin reduction. We call it skin tightening, but it's not. It's the same. It's the same skin, less of it. And that's what the tummy tuck would do. It's a big scar from hip to hip, and that's what most women end up needing. There is a mini tummy tuck that has a lower complication rate and a slightly faster recovery, but it doesn't remove nearly as much skin. So for most women...
So who qualifies for a mini tuck? Because I've talked to women who have gone in and thought they could get away with a mini tuck.
Correct.
But then had to go back and have it redone. So what is a mini tuck?
So the mini tummy tuck is essentially the same scar, and I think that's extremely important. When we look at things like laparoscopic surgery and minimally invasive surgery, you know, back when I trained, big scars, now a few little tiny portholes, that's truly mini. That's minimally invasive. In an abdominoplasty or a tummy tuck versus a mini tummy, you're talking about a scar, let's say from this to this. That's not a lot of difference. It's still a big scar. What happens with the mini tummy tuck is you don't move the belly button. So with a full tummy tuck, we'd leave the belly button attached to the stalk. The stalk is attached to the muscles, and then we'd pull the skin off, pull the skin down, cut off the excess, and then bring the belly out and back out. However, with the mini tummy tuck, you only pull the skin down and you leave this, the belly button attached to the stalk, attached to the surrounding skin. So it has to be a very specific anatomy where she has no stretch marks above the belly button and all of the loose skin is below the belly button. And what you'll notice, as far as anyone can just look in the mirror, if a woman stands up and her belly button kind of gets pulled down, and there's that little roll above the belly button where the skin wants to go down, but it's being held back by the umbilicus. Yeah, that's not a mini tummy tuck. That has to be a full tummy tuck.
So you're pulling up and down?
We just pull down.
Just pull down.
That's exactly right, yes.
And so are you having to reformulate the belly button or
Yes.
create?
And there's two ways to do that. One way, as we just discussed, is where you leave it attached to the stalk, pull the skin down, cut an oval out of the skin and bring the belly button back up and then stitch it down there. The other way is to remove the belly button and then a few months later in clinic, make a brand new belly button.
So who needs a new belly button?
Women or men, for that matter, who have had massive weight loss, often they've had so much stretching of their abdominal wall that they don't do well with an umbilical transposition for various reasons. And umbilical transposition is the fancy word for just the moving of the belly button.
Okay.
You keep your belly button, we just move the skin around it. And the other person would be if someone had an umbilical hernia or like an outie. If you have an umbilical hernia, well, the blood supply to that belly button is the stalk, but to fix the hernia, you have to cut the stalk. And so if you cut the skin off around the belly button and then you cut the blood supply off at the stalk, it's not going to survive. So a woman that had an umbilical hernia repair, which is easy to address at the same time that we do the tummy tuck, she would not be a candidate to keep her belly button. We'd make her a new one later.
Wow. So we talked about this really in terms of women who have had children, but there are also those candidates, women and men, who have had a large weight loss.
Correct.
And that skin, too, is skin that is not going anywhere.
And for the same reasons, exactly. It's been stretched beyond its capacity to recover. You get the stretch marks, and then it just doesn't spring back. And I think anyone that loses weight, they are kind of heroes in my eyes. It's so hard to lose weight. Even with bariatric surgery, they still have to stick to the diet, and it's a lifestyle change. It's the exercise. It's the watching what you eat. It's all of that. Wonderful. And then it just seems a little harsh that you do all this work, and then you're left with all this loose skin. And so in those patients, there are skin reduction procedures. The belly, the back, the breast, both in men and women. And men will also get a lot of enlargement, and then they'll have these man boobs, so to speak, very colloquially. And that can be addressed as well.
So what's the recovery time on that?
So that depends on the surgery. The tummy tuck is a pretty big recovery. It's a big dissection. If there's muscle tightening, it's a big thing, 3 to 4 weeks. But then a breast surgery might only be 5 to 7 days. So for a reduction or a lift, most women can be back at work.
So I missed something in the tummy tuck. So are you tightening the muscles at the same time?
That depends on people's practices. In my practice, if there's a separation of the muscles, I like to restore normal anatomy. And other people's practices, they'll do a tightening. I think it's important to remember that at the end of the day, the woman is the one that needs to be satisfied. Some patients come in saying, I want my stomach tightened. I don't care what you find. Done. We can tighten it a little more, absolutely. Some patients say, I work out, my muscle tone is fine, it's the skin. And because the muscle tightening, I treat that like a hernia repair. It's not a hernia repair, but I treat it like, so that's 8 to 10 weeks of no heavy lifting. That's definitely going to keep a woman out of the gym. So if she's very active, she wants to recover as quickly as possible, and she feels her muscle tone is already good, well, then she doesn't need a muscle tightening.
And so once that's done, how does the swelling play into the recovery? Because you've had this really big cut, and then there's going to be some swelling. Let's take a break here, but when we stay on point, we're back with more right after this. Welcome back, everybody, to the OPT Network. This is a must-hear conversation if you are thinking of having plastic surgery. Our guest this morning is Dr. Stephen Maguire. He's at MidState Orthopaedic, and he has been helping people fix those things that challenge them for well over 2 decades. And before we went to a break, Dr. Maguire, we were talking about the swelling. It's a real issue that comes anytime you're having major surgery. So
with the tummy tuck, what happens is the abdominal wall drains through a system of vessels called lymphatic vessels. And the lymph system is separate from the venous and the arterial system.
And what does that mean exactly?
Well, what it means from a practical perspective is that the abdominal wall drains into the inguinal lymph nodes, which are lymph nodes in your groin.
Okay.
And sometimes if you have like a leg infection, you'll feel those lymph nodes will enlarge. Well, those lymph nodes are then that lymphatic channels are cut when you do the tummy tuck or the paniculectomy, which means the
Tell us
remaining
what
skin.
the paniculectomy is for people who miss our
So,
off-screen conversation.
A tummy tuck and a paniculectomy, they're basically the same thing. You're cutting off the loose, extra lower abdominal skin. Paniculectomy, by definition, has less undermining, no liposuction, no muscle tightening, and you lose your belly button. And then the abdominoplasty has more undermining, so you can get more loose skin. It may have some adjunctive liposuction, may have some muscle tightening. You move the belly button, and that's the abdominoplasty.
Okay.
And those are different. What separates the two is what the woman needs. If a woman has had minimal weight fluctuations, a pregnancy or two, and some loose lower abdominal skin, then she'd be a great candidate for an abdominoplasty. If we're talking about someone that is heavier or was a bariatric patient who has lost over 100 pounds, they have all this loose skin, that's more of a paniculectomy.
Okay.
And so that's something that would be individualized to what they need. It isn't about, I paid for this, I'm going to get this. No, you get what you need based on your anatomy, based on your unique situation, how much you weigh now, the muscles, the extra skin, etc.
So after surgery for the tummy tuck or the paniculectomy, are you going to have to wear a compression garment? And what's the purpose?
Every surgeon has a different regimen. I like my patients to wear compression for a month. It's a comfort measure. It's a lot more comfortable to be bound up after having all that work. It's also a reminder to take it easy. And it does squeeze some of that extra fluid, keeping it from accumulating. What a patient will notice after they've recovered from the surgery is that by the end of the day, their belly's swollen. And then in the morning, they wake up and it's flat again. And it's what we're talking about, less than an inch. We're not saying inches of swelling, just a little bit more swollen. If they're very active, if they have salty foods, they get a little bit more edema, which is swelling in the tissue like a sponge. Different from a seroma, which is a collection of fluid like a balloon. And over time, it takes months and months and months, up to a year, the lymphatics will retrain or regrow, and then that will stop happening. So even after she's recovered, she'll still notice that by the end of the day, her belly's swollen, much the same way that a woman's ankles might be swollen by the end of the day. Some women have, their feet swell. It's the same process.
But it does resolve?
It does resolve.
And so for so many women, and I talked about at the top of the show, plastic surgery now not being something just for the rich and famous. Almost anybody who wants plastic surgery can have plastic surgery. And during the break, we were talking about those people that are going overseas.
Correct.
To get plastic surgery. Talk about, just from the medical perspective, the challenges that you see with that.
The biggest challenge with medical tourism, really for any surgery.
Medical tourism.
Medical tourism, you can, anywhere. You can have heart surgery, bariatric surgery, you can have your gallbladder taken out. A lot of people will go into Mexico if they're uninsured but have some money. They might go into Mexico to get their gallbladder taken out or their hernia repaired. The biggest problem immediately is that in the post-operative period, there's no doctor there to take care of you who did your surgery. The one that did the work isn't there to take care of you or any complications. When there's no complications, none of us want to have complications.
Right.
And I would love to tell you that I've never had one, but that would be a gross lie. Anyone that operates, anytime you cut skin, there's a risk of bleeding, infection, swelling, fluid collection, the skin edges dying. And these are involved surgeries, regardless of whether it's a reduction or a tummy tuck or the BBL. All these are involved. They're big surgeries. And the doctor that did it isn't there to take care of you. And you can't stay abroad for a month.
Right.
Whether it's, the Dominican or whether it's Mexico or any other country, really. And so that's where there's this lapse in care. So how do you see them if there's a problem? How do you see the person that knows you the best? The person that knows you, knows what they did. How do you see them when they're far away? And that matter, for that matter, medical tourism is really anytime it's not a convenient drive, whether it's Miami or New York or LA, you're going to have the same issues.
Same issues. And so for those people that are thinking of having this surgery, what's the most important thing that you want people to know? Sometimes it's medical reasons. Sometimes it's I just want to feel better about, my body image. What's the most important thing that you tell your patients about going into major surgery like this?
I think that's exactly right. It's a major surgery. It's life-changing. And you can't undo it. This isn't the kind of thing where later you're like, I'm just going to take that skin back. I made a mistake. You can't do that. And there will be complications. There will be pain. There will be scarring. There will be some period of recovery. There may be complications that are unusual but happen. And I think that you have to be realistic. I think if a woman, or a man for that matter, if a person entered into a cosmetic surgery or any plastic surgery, even if it was covered by insurance, and expected there'd be no scars and a rapid recovery and they're going to feel great in a week, and if that doesn't happen, they're going to be very disappointed. And I think making sure you know what you're getting into. The internet's a wonderful and terrible thing all at the same time. I think that when you do this research, it's important to research for certification. Are they board certified by their governing bodies? In my case, it'd be American Board of Plastic Surgery. But with any surgery, whether it's OB or GYN, are they board certified? Did they take the necessary testing to show a certain level of qualification? And also, I think it's a good idea to do a Google search on, or any search engine of your choice, on the complications of. I think it's good. Look at these pictures of surgeries that have gone sideways and say, oh, this could happen to me. And then with respect to the individual, are you at your goal weight? If you're diabetic, is your sugar well controlled? I personally don't operate on smokers for many surgeries. Not all. That's something that I need to talk to the patient about. I require some period of smoking cessation.
Why so?
So the nicotine causes the blood vessels to constrict. And normally
It's smaller.
And then it doesn't get the nutrients. So when you injure your tissue, it has more needs. It needs more blood. It needs more oxygen. It needs more nutrients to heal. So a difference between walking and running. I can walk all day long, but you're not going to find me running very far. And it's the same thing for your tissue. And so when I do a big surgery like a tummy tuck or a breast reduction, I have changed the blood supply in a bad way. And now I'm asking that woman's body to take the blood from way up here and trickle it down to the incision way down there. And the nicotine keeps those blood vessels from opening up. So suddenly you have tissue that has more metabolic demand and inadequate blood supply. That tissue is going to die. And then you're going to have a problem. And whether it's minor, like just thicker scars or a little edge separation, or whether it's major, like large portions of the skin rotting off, requiring additional surgeries, those are the kind of complications that can happen. And so those are the kind of things. So if you want to optimize yourself, just anyone you prepare for a race, if you were a runner, you want to prepare for your surgery.
Right.
You want to make sure that you're not smoking. You want to make sure that if you're a diabetic, that you're eating well. If you're on any immunosuppression, that you've met with your rheumatologist or endocrinologist or whomever has you on steroids or such, or your oncologist if you have cancer, to make sure that you're as good as you can be to recover from the surgery. Absolutely.
Before we got to leave this conversation, I want you to talk about why you don't do the Brazilian butt lifts. Why did you elect that wouldn't be a procedure that you'd want to do?
The Brazilian butt lift it's a good procedure and it works. And it involves taking fat from other parts of the body, typically the belly and the back. You wash that fat and then you re-inject it as a fat transfer or fat augmentation using your own tissue, which has benefits to using implants and such. Re-inject specifically into the buttocks to create a more projecting buttock. You have to be very careful how you do that. You have to inject between the skin and the muscle. If you inject it into the muscle, there's an increased risk for injecting fat into a blood vessel. It's a very vascular area. And that fat could then float up into the lungs, and you could have something called a fat embolus, which can be fatal.
Wow.
And so it's a safe operation when done safely, when done right. And that's a lot of responsibility. I think it's important to be responsible to the patient. This is something I'm uncomfortable with, and I'm busy doing other things as well. I can help people in other ways. There are a lot of doctors providing safe Brazilian butt lifts, and there are some providing unsafe Brazilian butt lifts.
So for those people, Dr. Maguire, that say, I want to come in and have a consultation, tell us what that looks and feels like and what patients that are thinking about cosmetic surgery should do.
Well, I think it's important to have a face-to-face consultation. I think that's important. I don't, I'm not here to slam a Zoom meeting if you're doctor's away, I still think you still need to spend that time. Are they willing to spend that time? Are you just
And you
seeing
need
a
to
bunch
have
of
a certain
videos?
rapport. I want to have a certain rapport with the person
Absolutely.
who's going to do a surgery that is that big and that personal.
And the problem is that once that surgery happens, the patient and the surgeon are tied together for some period of time until they recover. Maybe it's a couple visits, maybe it's a year. You know, if there's complications and touch-ups and stuff like that, and you want to make sure that you have a sense of confidence that that is the one you want doing your surgery. You don't want to have regrets in terms of, oh, you know, I had a bad feeling, but I did it anyway. No, I think it's important to trust your heart, trust your gut feeling on that, as well as do your research. And so, yeah, I think that visit is very important. It's important that they speak not just about the general aspects of the surgery, but the specifics, how they apply to you. Like I said, if you're diabetic and they don't address your diabetes, that's going to have an impact on the wound healing.
Absolutely.
You know, and if you're overweight and they're talking about the same surgery they would do on a skinny lady, you know, are they really tailoring that to you? Are they tailoring that conversation to you? Are they going to tailor your surgery to you? Every woman's a little different. Every surgery's a little different.
There you go. Well, for those people who are thinking of cosmetic surgery, you want to schedule a consultation. There's a lot to be said by having surgery at home. And so how can people reach out to you, Dr. Maguire?
I can be reached at MidState Orthopaedics. My division is MidState Plastic Surgery, but you can reach through the main line. You can go online and make an appointment as well, and that's the best way. You can also get a referral if it's medically related.
There you go. We'll have many more conversations because there's so much more to talk about. Dr. Maguire, thank you so much.
No, thank you.
Indeed. Hey, everybody, stay on point. We're back right after this.